Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and insightful show for you this evening. We're talking about the St. Luke's network of specialty pediatric practices to help families across our region from birth to young adulthood. Tonight, we'll be joined by an array of panelists from different pediatric specialties answering all of our must-know questions. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at pediatric specialties with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Jennifer Janko, Chair of Pediatrics for the network. Dr. Janko practices primary care in pediatrics and serves in an administrative role for the hospital. Dr. Janko was born and raised in Philadelphia and went on to medical school at Hahnemann University School of Medicine. Then she completed her pediatric residency at St. Christopher's Hospital for Children. Dr. Janko joined the St. Luke's Network in 2006 and has recently been awarded the Lehigh Valley Business Healthcare Hero Award by the community for outstanding advancement of pediatric services. Dr. Janko works with her patients in a variety of ways, from their preventative care all the way through sick care, such as cold or cough, or other chronic conditions like asthma. Dr. Janko, thank you so much for being here.
Thank you for having me. I'm excited to talk pediatrics.
What got you started in pediatrics and this career path that has led you to the chair position that you're in today?
I think it kind of found me more than me finding the career. I truly, since I was in kindergarten, since 5 years of age, wanted to be a pediatrician, and the privilege of working with children and families now for over 20 years is so rewarding. It just keeps pulling me in deeper and deeper. The chairman's role was really unexpected. I had been at St. Luke's for a while, and what I found is I had ideas and people wanted to listen to them. So we just kept growing to the point that we have so many new additions to talk about.
It's so great to see your passion for pediatrics and to see how far the department has come in your tenure. So thanks again for being here. Joining our panel next is Dr. Shaheen Timapuri. Dr. Timapuri is a board-certified pediatric general surgeon who cares for children from newborn to adolescent. As a pediatric surgeon, she treats a wide variety of surgical conditions, focusing on abdominal, thoracic, and minimally invasive surgery. She recently completed her MBA and hopes to use this added expertise to continue expanding the pediatric surgical program at St. Luke's and contribute to the amazing growth of pediatric care within the network. Dr. Timapuri, we're really excited you could be with us tonight.
It's truly my pleasure. Thank you for having me.
Dr. Timapuri, tell me about coming to St. Luke's. How have you found the culture? How have you found the experience? And how have you found the patients of the Lehigh Valley?
I've been a pediatric surgeon for about 13 years now, but have been in the Lehigh Valley for the last year. And I've really found the culture to be so amazing at St. Luke's. There's a true focus on quality, patient safety, and true collegiality, which really allows us to provide the best care for our patients within the region.
Well, we're so glad that you're with us and that you're with us not only tonight, but here at the network, so thank you. Let's meet our final panelist, Dr. Nicholas Grimm. Joining the network in 2020, Dr. Grimm is a board-eligible orthopedic surgeon specializing in pediatric orthopedics. He was born and raised in Cincinnati, Ohio, and completed both medical school and residency in Pennsylvania. Following his residency in orthopedic surgery at the Philadelphia College of Osteopathic Medicine, he went on to complete a fellowship in pediatric orthopedics at Washington University Shriners Hospital in St. Louis. While in fellowship, he received extensive training in general pediatric orthopedics, including trauma, sports medicine, and hip dysplasia. Dr. Grimm, thank you for joining us.
Yeah, great to be here. Thanks for having me.
Dr. Grimm, tell us a little bit more about your interest in pediatric orthopedic surgery. It's so specific. How did you get into that, and what challenges you to keep learning as you expand into this field?
I always loved orthopedics. I always loved taking care of patients, kind of seeing a problem, treating it, and moving on. And I think pediatric orthopedics specifically addresses that Pediatric orthopedics is a growing field. It's even becoming more specialized within pediatric orthopedics. So it's really important to stay on top of all the latest techniques and all the latest literature to give the patients the best care possible.
Excellent. Well, we're so glad that you're here and that St. Luke's is able to offer this specialty. Thank you all for joining us and giving some background information on your expertise and your interest in pediatric specialties. Up next, we'll dig deeper into the basics of each of your disciplines at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Pediatric intensive care is a really great and growing field. The treatments that we offer 1 year are completely different than from what we were able to offer 10 years ago. We're able to help families come from one of the most difficult and stressful times in their life to an almost complete or full recovery. The challenges are always unique to each situation and each family, and I'm fortunate to be able to help the folks of Bethlehem here at the Bethlehem campus. The pediatric ICU is an 8-bed unit that's located at the Bethlehem campus. Pediatric intensive care is for the children that require really frequent monitoring, advanced treatment, and things that can only be done in an ICU setting. The pediatric ICU was really designed with both the community and specifically for children in mind. We have a ton of great age-appropriate stuff that's available for children. It helps them keep a little bit of home while they're here in a difficult hospital setting. It ranges from great television and kind of entertainment support. We have great donations and community support to help keep the kids happy while they're here, and then a great group of nurses that are trained in helping them through these difficult times. In the intensive care unit, we see children in a huge range of acuity. Unfortunately, for some children, it can be their worst day of their life. They could have a very serious breathing event. They could have problems with their heart. And fortunately for us, we're able to support them through that, and nearly all of our children get better. We have great support from our pediatric unit and a great group of pediatricians that work with us in the community.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Janko, Dr. Timapuri, and Dr. Grimm. We've learned about your backgrounds and your expertise in this field. Now I want to talk about some basics of the pediatric specialty care that you provide at St. Luke's. Dr. Janko, I'm going to start with you. Why is it important for parents to establish a pediatrician for their children right from the beginning, right from birth, and stay up to date with their appointments and their vaccinations?
Getting a child from birth to adulthood is no easy task. And I think every parent, every family needs a partner in doing that. And the pediatrician is the natural person to do all of that. Even if the child has absolutely no problems, somebody still needs to guide a child. They don't come with an instruction book, right? So we need to help guide these families through, is my child growing normally, developing appropriately? How about injury prevention? What things we should be looking for? There's so many preventative things, which is one of the things I love about being a pediatrician is I try to get every child to age 18 in as healthy condition as I can. And I don't think anyone is better positioned to do that with a parent than someone who's specially trained in children.
You're right. Yeah, kids definitely do not come with an instruction manual. And I can say as a mother of two, my pediatrician was really my guidebook throughout their childhood and provided me with so much information and just to help and kept us on a path to keep our kids healthy. So I really value that relationship and encourage parents to make sure you have a pediatrician. Dr. Timapuri, I want to ask you about surgery because you as a surgeon, you must be in constant contact with the pediatrician that has been treating that child up until that point. So can you talk to me a little bit about that relationship and then also when a parent might be referred to you?
I think that relationship between a pediatrician and a pediatric surgeon is critical. One of the most important components is the communication that we have. And, I found at St. Luke's, we really have a nice open system of communication where a pediatrician can convey any concerns they have to the surgeon, and we can help to address whether or not a child needs to be seen, whether they need surgery, and help to guide further treatment. As pediatric surgeons, we take care of children for various conditions and also a broad age range. We take care of illnesses within the chest and the lungs, within the belly, and children develop all sorts of little lumps and bumps that parents might find. And that's sometimes things that surgeons may be involved in evaluating and maybe even removing. Some of the most common things are things like hernias, appendicitis, and like we said, all those other little things that parents might find on their kids.
And certainly it's nice to know that often you might be referred to a surgeon and not actually need surgery.
That's one of the most important things, I think, for parents to remember. Just because they're seeing a surgeon doesn't mean that anything terrible is wrong with their child. It's just really to have that second level of evaluation in addition to their pediatrician's care.
That's great for people to know. And Dr. Grimm, I want to talk to you a little bit about the difference between general pediatric surgery and pediatric orthopedic surgery. What do you specialize in, and when might a parent come see you? What kind of conditions are you treating?
Pediatric orthopedic surgeons have done a orthopedic surgery residency prior to doing a fellowship to specialize in just pediatric orthopedics. So orthopedic surgery by itself is surgery for the musculoskeletal system for patients of all ages. Pediatric orthopedic surgery is for patients less than 18 years of age. So a lot of what I see would be typical acute injuries such as fractures, sports injuries, ligament tears, that sort of thing. But where the pediatric orthopedic surgeon really kind of separates themselves from the adult orthopedic surgeon is in the ability to take care of congenital deformities, things like club feet, hip dysplasia, a lot of things that children are born with that have to do with the musculoskeletal system.
When you think about orthopedics and you think about joints, and when you think about children, you think about growth plates. And how important is it for your specialty to be considered when a child needs orthopedic care, in the sense that they're still growing and they're not the same as treating an adult? How do you take that into consideration?
There's a lot of specific injuries that only children will get because of the open growth plates. A lot of times x-rays or injuries can be misinterpreted if it's something that you're not seeing every day. But for me, I see 40 to 50 children in the office sometimes in a day, and I'm seeing the same x-rays over and over, the same injuries that for me are very typical.
Yeah, the more you see, the more of an expert you become, certainly. Dr. Janko, tell us how St. Luke's has expanded its pediatric service line over the last couple of years in particular, and why this is so important to the families of the Lehigh Valley.
So we now have about 14 different areas of pediatric expertise that parents can have. And I think that it's important because you might never need them, and that's okay. And I hope your child doesn't. But when you do, or if you do, having that expertise right here, local, because sometimes the worry is half the issue of waiting for that appointment and having to go to an unfamiliar place can be really devastating for a family when they're told they need to see a specialist. Things that we've added: endocrinology, which takes care of things like diabetes and hormone issues; nephrology, which we have the only one in the area to take care of children with kidney problems or dialysis needs; GI. So a lot of patients have lots of stomach problems, something simple like constipation or something significant like Crohn's disease. All of these people, just like Dr. Timopori and Dr. Grimm, are specially trained in diseases that only children get, and in the approach to a child: pain management, management of fear and anxiety, management of the family. Every patient is a family. So, how to have those communication skills. And I think this is really life-changing for families in our Lehigh Valley area.
What great and important information from all our panelists, but we're not done yet. After the break, we'll learn more about the variety of specialties in pediatrics offered across the network. You're watching St. Luke's Health Now.
Hi, I'm Noah Kostick. I'm in 10th grade and I go to Liberty High School. I actually don't remember that day at all.
The day that everything happened with Noah, it was a typical day. My sister Mary was having a first birthday party for her son. She has a little patio in the back, so all the boys were playing basketball. Maybe like 5 minutes later or so, my sister Mary comes out the back door and she said, "Gina, something's wrong with Noah." I looked at Noah. He was laying on the couch on his side, almost looked like he was convulsing, and I said, "Call 911. We get to the trauma center at St. Luke's main campus, take him back into the trauma room, and I'm sitting in that little waiting room. The doctor comes out, and he's like, "Okay, Noah, we have him stable, and we think it's WPW." He actually had 5 extra electrical pathways. But I was just like, wow, they already know what's going on. Noah was in the hospital, the PIC unit, for about a week to get him stabilized.
For all the doctors that helped me, I'm thankful for them because they're so nice to me, and they're my second family and stuff. So it's kind of nice for them to be around me when I was going through that time.
I am grateful for St. Luke's because all they cared about was making Noah comfortable, getting Noah better.
It was a crazy experience, but like thankful for them for like doing everything for me and like their best just to make me like who I am today, because I'm doing good, back to weightlifting for football, so I feel like I've came a long way. Because of St. Luke's, I am here today.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about pediatrics and the many pediatric specialties offered at St. Luke's. In case you're just tuning in, I'm being joined by 3 St. Luke's medical professionals, Dr. Janko, Dr. Timapuri, and Dr. Grimm. Thank you all for being here. In the first part of the program, we talked about your backgrounds and some basics of pediatric specialties. Now let's dive deeper into these specialties and the addition of services our community has seen in the recent years. Dr. Timapuri, I would love to know, how do you approach your patients? Because you're not just dealing with the child, you're dealing with the family, and there are so many fears and anxieties that might be included and other things to consider outside of just the actual surgery the patient needs.
Surgery can be scary at any age, but especially for children. And I think we have to consider that it's not just the child who's afraid, but the fear that a parent feels when their child needs to undergo surgery can be tremendous. So I think one of the most important things for us to do as pediatric specialists and pediatric surgeons is to communicate well with the family. So really spending time making sure that they understand what their child's condition is, what type of surgery needs to be done and why, what are the risks and benefits, what are the details? And by the same token, taking time to explain these things to the children, obviously in an age-appropriate manner. So if you can try to gain their trust and communicate well with them, I think that goes a long way towards alleviating at least some of their anxiety prior to surgery.
I think that concept of treating the entire family with respect, but especially the children, they can often understand more than we give them credit for. And Dr. Grimm, I want to turn to you because you work often with children who are in the new PICU, the Pediatric Intensive Care Unit that is new to St. Luke's. It's such an incredible service to have a PICU at St. Luke's. Tell me a little bit about your approach to the patients in the PICU and your communication with their families and them throughout their journey, because often they're there for maybe a serious reason.
So the patients in the PICU or the pediatric ICU are typically patients that are a little sicker than patients that would otherwise be on the general pediatric floor. When I get involved with those patients, it's either a patient that underwent a pretty serious trauma or a patient that may have a very serious infection. So I always try to put the patients at ease, put the families at ease, and try to put myself in their position and try to communicate as best possible that I can, because it's a very stressful time for everyone involved. And these patients typically do very well because they are children, but it can be a very stressful experience. So I try to guide the families as much as possible.
Certainly seeing that resiliency we often see in kids has got to give all of you a lot of hope as you treat your patients and as you comfort them through the process. Dr. Janko, there's something really exciting coming, the Pediatric Specialties Center. It's opening next year. Why is this new building so important to the growth of pediatrics at St. Luke's, and how will it help the children of the Lehigh Valley?
So this building is more than the sum of its parts. This is our Pediatric Specialties Center opening in 2022 that will have all of our many pediatric specialists housed in one building. And I think that means many things. First and foremost, it means convenience and access for families. So if they need to see more than one specialist, they don't need to drive to one section of town on one day and another section of town on a different day. So I think having that convenience factor is really key. But I also think it allows all of the doctors to even work as a more unified team. They work great right now and the communication is fantastic, but when you're all under one roof and patients need care from multiple different specialists, that coordination of care aspect, I think, is so much more aligned. Other services that will be in there will include things like physical therapy, occupational therapy, speech therapy. They will all be in one easy place. And that's what we're trying to make this it's hard enough being a parent. We're trying to make this easier for people.
It's such a challenge to get your kids from point A to point B and where they're supposed to be. And when you throw in an illness or the need for surgery or some sort of treatment, and you've got other children at home, the time and the expense involved can often be more than most families can bear. So these additional services, I think, are such an added benefit to the families of the Lehigh Valley. Dr. Timapuri, how do you see this surgical program growing over the next few years? Do you see services that might be added and things that parents can almost look forward to knowing that's right there in their backyard?
Well, we're happy to announce that there's a second pediatric surgeon starting later this year, another very experienced surgeon. So it'll be a very nice addition. Even just having two of us allows us to increase the complexity and the types of cases that we treat. Now that we're starting to treat more complex conditions, we can actually integrate that and build more multi-specialty types of programs to help take care of children locally. We also hope to expand some of the areas of the hospital to make them even more comfortable and friendly for the children and their families when they're in that perioperative period, meaning the time before and after surgery, so that children can feel very comfortable in a more child-friendly environment. So all of these things are things we're looking forward to over the next few years at St. Luke's.
Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's knows that trust is the foundation of all relationships. It's earned over time. It's the type of relationship you should have with your healthcare team. While our healthcare needs are different, one thing is constant. St. Luke's is focused on building a lasting relationship with you, earning your trust and putting your well-being first. When it comes to great healthcare, trust is essential. St. Luke's, the care you trust, now more than ever. Do you want to have your child see the pediatrician, but you wonder if now is a safe time? Well visits and vaccines are more important now than ever. St. Luke's Pediatrics offers options to streamline your visit, like over-the-phone screenings before you come in, virtual visits you could do from home, and some practices even offer curbside consultations. St. Luke's wants to keep you and your child safe and healthy, so call us today. St. Luke's, my health, my hospital, our community.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about pediatric specialties at St. Luke's. Now we're going to get into some audience questions. Are you guys ready?
We're ready.
All right, this is for anybody, but I think this might be for you, Dr. Janko. How do I find a pediatrician for my child, and how do I know if I can trust them with the care of my newborn baby?
Parents should put some time into making that decision. You can certainly go onto the St. Luke's website, and we'll list and describe information about all of our many St. Luke's pediatricians. I would say looking for something like being fellowship trained in the American Board of Pediatrics, so being board certified. So wanting to make sure that they have had all their training, and you can easily find out if someone has certification through the American Board of Pediatrics. Many of our offices, whether you are pregnant and expecting a new baby or just new to the area and looking for a new pediatrician, will do kind of like a meet and greet. So if you just want to call up the practice, either through Zoom or through in person, we're very happy to do that with families, so you can get a look and a feel for the office itself to kind of gauge your comfort level.
That's a really great idea and a really good way to get a feel for your relationship and sort of what you think about a pediatrician before you sign on. So that's great advice. All right, Dr. Graham, I think this is a good one for you. What's the difference between the ER and the PICU, the Pediatric Intensive Care Unit?
So the ER is the emergency room. The PICU, or the Pediatric Intensive Care Unit, is an inpatient unit in the hospital. And that's typically where some of the sickest patients in the hospital will be, pediatric specific. The emergency room is where most patients that are coming to the hospital go to the emergency room first. If you have any sort of acute injury or sickness or need to be evaluated by an emergency room physician, you would go to the emergency room first and then potentially be admitted to the hospital. And then if, God forbid, one of the patients were some of the sicker patients, they would go to the PICU.
So that's something that would be decided once you've been evaluated in the ER and perhaps one of you specialists has come in to see the child and evaluate their condition.
Exactly. So evaluated by a physician first, and then the care is escalated as needed to potentially an inpatient stay or a PICU stay.
All right, this is a surgery question, so Dr. Timapuri, I'm going to switch to you. Is surgery dangerous for my child, and can I be there with them during the surgery? Of course, parents, we don't like to leave our kids, right? It's so scary. We want to be there and we want to hold them. Can they be there during surgery?
Those are excellent questions, and questions that we get very frequently. First of all, for the first part, anything we do in medicine has risks. But I will say in an otherwise healthy child, surgery is typically very safe. It is important to have specialists that are comfortable taking care of children, especially when we're talking about the younger age groups. That's why people like myself and Dr. Grimm, we're specially trained in the care of children and surgery in children. But we also have other specialists like pediatric anesthesiologists who are used to managing the medications and the breathing of children during surgery, which is also extremely important. But with those things in place, we're always looking at all of the risk factors for a child and helping to weigh the risks and benefits, and also decide on the best timing of surgery for kids. Parents can be with children up to a certain point. It's not safe or really anything that you want to be present for during the actual procedure. But parents are able to be with children right up until the time when children go back into the operating room. And then once they wake up, the parents can be with them in the recovery room. So really the child's only away from them for a finite period of time. And that's just for safety for everyone.
All right, here's a question I'll throw out to the group. My child is too young to get the COVID vaccine. What should I do in the meantime?
So I'd say that basic things that you can do is, like we do with other infectious diseases, is vaccinating everyone who comes in contact with that 2-year-old. So everyone 12 and older is eligible to be COVID vaccinated. So older siblings, parents, grandparents, if everybody else is COVID vaccinated, that's going to help decrease the likelihood of the 2-year-old getting COVID. American Council of Pediatrics and us pediatricians do recommend masking appropriately for children 2 and older. So if they're able to, mask, and when you're out and about, I don't think that that's a bad idea. Good hand washing. And again, the relationship with your pediatrician. So if you think your child is sick and you're not sure, call your pediatrician. There's a simple test we can do if we need to figure out if something is COVID or not COVID.
That's great advice. And our last question here, I'll throw out to all of you as well. Am I being a bother to my child's doctor if I keep asking questions? So parents have a lot of questions, right? We just want to know, and of course want to make sure our kids are safe. So who wants to take that one?
I could start with that one, because parents are frequently concerned, when they come to see the surgeon, if they're asking too many questions, if they're bothering us. And we want to reiterate, it's never a bother. I really want parents to feel comfortable and to ask everything that they want to ask. Even children, we encourage them to ask any questions, no questions too small. But if there's anything we can do to help to alleviate their anxiety and increase their understanding of the problem, we would love to do it. So, if we can answer things during the office visit, great. They can even call back later for more information, and we're happy to help.
I would agree with that. I enjoy when patients come with a list of questions and say, I have a list. And I say, pull out your paper. Let's go through them. And I also agree with Dr. Timapuri. If we're not the ones answering those questions, my worry is that parents might be getting misinformation from other sources and getting the wrong answers to their questions.
Well, that's a really important point, and I think that it's great to know that, especially in pediatrics, but certainly across the entire St. Luke's network, the physicians encourage question asking and getting the proper information to get the proper care. Dr. Janko, Dr. Timapuri, and Dr. Grimm, thank you so much for joining us, and thank you to all of you for tuning in. For more information on pediatric specialties at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thank you for tuning in. Until next time, be well, and remember, it's important to focus on your health now.